Hello everyone, it's Ruchika Nirvan here. I am director at Learn and Play and I am a psychologist and a flow time practitioner. At Learn and Play, we deal with kids with special needs using play as a mode, and we build child skills through play method. So, one thing that I feel is that kids they feel less anxious when it's a play based approach, and they want to learn more and seek more things around them in a very natural environment. So today we have Dr. Kriti Vyas with us, and she is going to talk about how to be an emotional coach, which is a very deep topic for our kids, especially kids who are growing, and because our kids they face difficulty in conveying emotions, getting language and appropriate communication of telling other person that how they are feeling. So let's have Dr. Kriti with us. And hi, Dr. Kriti.
Hi Ruchika, how are you?
I am good. How are you?
I am good. Yeah.
Yeah, so please, can you tell people about yourself a little?
I am Dr. Kriti Vyas, and by profession, I am a child psychologist and a special educator. So I'm been into this area from quite a long time, approximately now 10 years. So being associated with the clinical setup, school setup, or university setup. So dealt with kids with various learning or behavioral issues, be it learning disability, ADHD, or any emotional issues as well, and wide range of, like, in terms of age groups also, wide range of age group. So yeah, and currently I'm placed in Hyderabad. I'm working in an international school setup. So there
Okay.
I'm taking psychology teaching, as well as I'm taking care of special education and counseling. Yeah.
That's really nice, Doctor. Yeah. So today we are going to talk about how to be an emotional coach, right?
Yeah.
Yeah. So let's start and let's share with everyone.
Yeah, so can I share my screen now?
Yeah, you can.
Oh, okay. I hope the screen is visible to everyone. Yeah.
Yes, it is visible.
Yeah. So today's topic, as Ms. Ruchika just said, that it is how to be an emotion coach. So this concept was given by Gottman and his team, and there is a group of psychologists who worked in the area of parenting. So this theory came up after the Baumrinn's famous parenting style that we all know, and but these researchers came up with a emotional related parenting style and added emotional component to the prevalent parenting style. So they did a lot of research, they studied a lot of group of parents, interviewed them, conducted study, and on the basis of that they came up with the four parenting styles. And these parenting styles, like, it's basically, again I am emphasizing, it's based on how we respond to children's emotion. So based on this they came up with four styles of parenting, and
Mhm.
these are dismissing parents, disproving parents, laissez-faire parents, emotion coaching parents. So we will look into these parenting styles one by one. So let's start with the first one. The first one is dismissing parents. So these parents are basically, like, they are not aware about the lower intensity emotions. Now, when we talk about lower intensity emotions, we are focusing on the minor day-to-day feelings. Like if in a class, let's say I'm working with my crayons, a child is working with a crayon, and accidentally their crayon fell down on the ground and it broke. Or maybe I got a toy, my child has a toy and she loves playing with that toy, and some neighbor child came in and he took away that toy. So these are very small, like, moments And these moments are like important for the child if we see from a child's perspective. So these the emotions which are attached with that particular crayon or that particular toy, maybe these kind of parents will not be able to acknowledge that, or may not be able to feel okay why these things might matter. So
Mhm.
they won't able to what you can say, judge that why my child is crying over such a petty thing. So those in few examples, or from the research also, when I was looking at working on this particular topic, so there were examples like which is there in the slide also. So when parent was asked when was last your child was sad, so parent couldn't recognize that okay, like everyday emotions. He was focused, okay, my child, when she was 4 years of old and she went to the grandma's place, and when she was coming back, she was a bit sad, that's it. So they, when they are not able to notice these lower intensity emotions, then they lose the chance to connect with the child or
Mhm.
to form a relationship with the child.
Yeah.
And another belief these kind of parents have, that negative emotions are toxins, so they should be avoided at all cost. So now because they want my child to be cheerful, and they can't associate that the fact that my child can be upset, or my child can be sad or angry. So if
Mhm.
we research suggests that if we look at the background of these parents, because it's not like there's no bible for a parenting thing, so we all learn from our experiences or our childhood experiences. So when the researchers reflected back on their parenting style, like how they were being parented when they were small, so there were some incidents where parents quoted that they were living into a very where you can say a hostile kind of environment, or maybe where those negative emotions are not communicated between the family members. Like there were incident where a parent quoted that I was being raised in a family where there's a constant drift between my parents and between my mother and the father.
Mhm.
So as a result, what happens though during that time of conflict, the child is being sent to his room and they're not allowed to speak. So they
Mhm.
learn from the beginning that okay, these negative emotions are need to be suppressed. So they can't show those negative emotions. If they show, they will be reprimanded. So these kind of experiences, they tend to bring in their parenting as well. And
Yeah.
that's why we have a category of dismissing parents. So
Mhm.
whenever they feel that the child is upset, they will not focus, okay, that okay, I will let me empathize with my child or come up with certain solution. They will try to distract, okay, it is a very little thing or it is very trivial thing, let's cheer
Mhm.
up. Or maybe let's say when I was, because this was also a part of my PhD, one of the variable there. And when I
Okay.
was interacting with the parents, and I could see sense that there was one particular child who has a dark skin tone. So it
Mhm.
was a everyday affair that whenever he used to go to his classroom, he was being termed as Kalu, Kalu, Kalu kind of word. So what was the reaction, or how I asked the mother, how would you help him out in this regard? So she would say, I would just say, okay, ignore these feelings, don't talk to this boy, move away from this. So it's like you are just not giving us empathizing with the child, you are just asking him
Yeah.
to just shove off those feelings. So
Mhm.
this is why when we will also look into detail like how these kind of parenting will have an impact on the personality of the child when he grows up. So this is one of the parenting style which is called a dismissing parents.
Mhm.
In For every parenting style, it's not like they are like what we can call Jani Dushman of the child. No, they basically they want to protect their child. That's the
Yeah.
thing, and they
Mhm.
don't know how to do that. So they based on their own experience, whatever they have learned, that negative emotion, oh, I have to shut down. So
Mhm.
based on that, they try to work with the child.
Yeah.
So, similar to this, next parenting style is disproving parents. So, these kind of parents are same in regard to dismissing parents. They also trivialize or ignore child's emotion, but at the same time, they criticize also. They reprimand. So, if a child is being angry, so the mother will spank him or give him a nice beating or something, or the child father is making a child to sleep and he's crying, so he's, because of this annoying emotion, he's not able to take it up and he will end up scolding. So they are one step ahead, that they will start reprimanding, criticizing, or disciplining or punishing the child. So these parents have a belief that why the child is showing the emotions, negative emotion, because they want to manipulate us, and in the end they want something from us to be given to them. So as a
Mm-hmm.
manipulation, as a trick they want. And they also believe, have a similar belief, that there's negative emotions are bad. It is not something we have to live it with it, and it has to be controlled. So specifically, like with boys, it usually happen like we all often say, like listen, people saying that boys don't cry, or they are being punished for for crying. So disproving parents will have a belief that mm, that if the child is being cranky or showing anger or some upset, it's a waste of time. And like they will say, losing a toy or a fight, having a fight with the friend is a normal thing. You have to deal with it. You have to be a tough boy or tough girl. So basically, they believe that these negative emotions, we don't just need to control it, suppress it. There is no need to express.
Mm-hmm.
So I have also seen in my clinical practice. So I was dealing with a girl, and looking like she had a lot of emotional and anxiety issues. So I was looking back at her, how the parents are rearing or how the parenting was happening. So when I had interaction with her dad, so I told her, because there were also issues with that particular girl, that she was not able to gel up with the kids. Kids are
Mm-hmm.
making fun of her, and in order to get friends she would start lying, and all those stuff were happening. So I shared with the parents, and I told the father that this is what it's happening. So he said, so what, it is when, if she cries at home for such things, I simply scold her. I don't feel that she needs to cry on such petty things, because ultimately she needs to learn from it. So
Mm-hmm.
I told the father, yes, I acknowledge the fact that it is important for the child to ultimately deal with the situation and be tough, but
Yeah.
at this moment you are operating as from an adult side, and that child is operating as a child. So at that point, it would be great if we empathize with him or her and then give a solution. Okay, this is how things work on, and we can deal with like that. But straight away criticizing, judging, and trivializing the child's issue will automatically impact the personality. And it
True.
was reflecting in her behavior as well. So this is what disproving parents are.
Yeah.
Next, we have laissez-faire parents. So these parents are not like dismissing or disapproval parents. They accept the child's emotion. They will pamper him, or they will offer comfort, but at the same time they will, like they don't know how to deal with it. So they feel that, okay, if I am giving a space for child to let it out, it's fine. But further problem solving is not done by the parent. So let's say like they feel that, okay, my if my child is screaming in anger, if my yelling in anger, it is completely fine, they have the right to do so. But okay, to the certain extent, yes, but this is not a healthy way of coping with those emotions. So okay, this time he or she is being angry or yelling and screaming at you at the home front. Same thing will happen when he grows up and he will move out of his like home and be in school. There, what will happen there, also he will start screaming, yelling, and then there will be a huge like conflicting situation
Yeah.
at school front. So But at the same time, if you talk to these parents, they believe that okay, I need to protect my child, I need to provide the comfort. But they don't understand that at the same time we need to put certain limits or give them a problem solving situations or come up with some solutions. So at the same time, like if a child is cranky, the mother will come and console him or her and say that okay, I understand your pain, I have also gone through the same thing. But now she will move out and do her own job, and now the child is left alone. Okay,
Or maybe
somebody come.
clueless, yeah.
Yeah, he's clueless about it, that how I need to move forward. So this is again, if you see the outcome of this style of parenting is again the children don't have a emotional control, they don't know how to control my own impulses and behave in a more productive or a healthy way. So this is what
Mhm.
this parenting style is talking about.
But I have a question here, Kriti. So,
Yes.
like, suppose a child parent is not able to give a solution to their own child,
Mm-hmm.
maybe because they don't even they themselves have no side that what should they say, or how they should control
Mm-hmm.
these emotions.
Hmm. Hmm. Hmm.
So,
Hmm.
what do you think? Well, I've seen a lot of parents do, kids parents, where I feel that they are clueless and they want their child to decide, so they let it be.
Okay, so at least at that situation, you can guide him, or at least come. See, nobody knows a perfect solution for for a problem, but at least guide the child. Okay, you can find ways like this. At least you can brainstorm certain solution, or if he is coming with certain solution, you can ask him to weigh the pros and cons at least. So certain way, it's I
Yeah,
understand, because it's not easy for everyone to. There's no we parents are not superhumans that they will come up with answers for each and every question, but at least
yeah.
some guiding force, that okay.
Mm-hmm.
And It usually happens like when we start practicing this skill of emotion coaching, automatically you will able to, when you work in collaboration with the child will automatically come up with the solution, and then you can ask him, okay, uh, what could be, if we go by this, what could be the advantage of that, if you go by that, what could be the advantage of that. So this
Yeah,
way at least problem solving skills are developing.
yeah. So at times I feel that parents, they feel like their journey, they were not helped as in emotionally by their own parents, so they feel
Yes.
that my child will also do the same,
Yes.
and somehow there is this assurance, okay, that this will go on its own.
Yes. Yeah. Yeah.
Yeah.
True. True. We
And I think
do.
this pattern needs to change.
Yes, this pattern needs to change, because the way we were grown up, or when the way we were supported by the parents or not supported by the parents, what was there in the history. So it was not like something which we can change it or which we can modify it. Now we have to judge or our parenting according to the current scenario. So what my parents were using, let's say 10, 20, 15 years ago, might not be applicable in such situation. So looking at
Yeah,
the current situation and looking at the current scenario, we have to work accordingly. So that's what
true.
that is more important.
Yeah, yeah,
Yeah.
right.
So, yeah. So moving to the next, that is the important part of our topic today, the emotion coach. So when we talk about a emotion coaching parent who use this emotion coaching style, the parents, whenever a child is in any negative emotion state, parent feel that okay, they don't feel scared of addressing those emotions. They feel okay, this is the time I can connect with my child, I can know him or her better, and I can try to help him out in a better way so that he can regulate his emotions, and ultimately that connection and bond can be formed. So that is ultimate aim of a parenting. So this is what emotion coaching parents believe, and as we move on with our presentation, we will look into the steps how a parent can learn this emotion coaching parenting style, because ultimately it is important that we address those emotions. If we are not addressing those emotions, somewhere like you must be also be aware that how those suppressed emotions start impacting our adult personality,
Yeah.
or how they start impacting their relationship when the child grow up and form a adult relationship. So there
Yeah.
his
Right.
self-esteem and everything get impacted. So if you value
Mhm.
child's emotion, understand him, acknowledge him, spend time with the child and without being impatient, so then again that bond and connect will be, you will be able to form that. So I have a example. I have a situation here. I have quoted a situation where a parent, like if a pa- emo, in a if a situation is there where there is a situation where the child don't want to go home, sorry, go to school, and the mother is asking him to, no, it's time to go to school, but the child is crying, no, I don't, I hate school. So now if you see, oh, you don't like school, that's not what you usually say, has something happened? So now this statement, looking at this statement only, we could figure out how quickly the mother is able to sense something, that okay,
Yeah.
earlier he was not like that, maybe something has happened. So now she's not into advising mode, no, you should go school or do like that. She's into questioning mode, and questioning with more of respect and empathy. Okay, what happened then? So the moment she start having that, acknowledging his emotion, that oh, you seem so sad, or like must be something happened, so the child start crying. So then when the child start crying, the mother comfort him. So that comfort space is also very important, like cuddling or going close to the child, looking, making eye contact, and then acknowledging the feeling that yes, you must be something sad or happened, that's why you're not want to go to school. So then Rohan says, yes, I want to stay at home. And then mother again acknowledge the feeling and ask him, try acknowledging and reflecting back those feelings. Okay, so then he starts telling that I hate Rahul. Then did something happen with him yesterday? So yeah, he pushed me over in the cafeteria and called me mad. So now when he says that, often we say, parents said, oh, don't talk to this boy now, play with somebody else, without. But now if we see, oh, that's a bit rough, no wonder you are feeling sad, maybe you are a bit angry with him too, saying that in front of your friends. So which means now mother is acknowledging or empathizing that when somebody said you like that, when somebody pushed you, when somebody is calling you mad, it must be hurtful for you, you must be feeling that pain. So when we acknowledge that pain, child will automatically feel, yes, my somebody is there for me to provide me comfort.
Yeah.
So and now when Rohan said, yeah, I'm not playing with him anymore, I would rather play with Pratik. So when you acknowledged it, automatically a solution comes up in his mind. Okay, I will not play with Rohan anymore, I'll play with Pratik. So now mother acknowledged that idea. Oh yes, so you think that might be, you might play with someone else. That sound a great idea. I'm sure you will have fun with Pratik. So Rohan is fine. Rohan feel acknowledged. Rohan go back to school. So this kind of technique, even Gottman himself said that when you start, it's not like it's a like a hypothetical situation or a situation which is created. But if you go or follow these kind of steps, maybe not in the first go, you will reach a successful solution. But slowly, at least you can build that skill.
Yeah.
So even with the when I was working with one of the kid who has lot of anger issues, and in school also he was like, he was a junior KG, senior KG kid, and that in that age also he was so verbal for his own feeling, and he would hit students in the class, and he was very aggressive, and he would if he don't want to like go to a playground, then he will be very adamant and sit there only. Similar behavior was seen at home. So when we train the parents to try to see this kind, or try to acknowledge his feelings, because what was happening is in the bus, he somebody was calling him with a bad name, and somebody said, you won't sit here. So those hurtful feelings were there, and he was displacing those hurtful feelings with his classmates, and nobody was understanding, and everybody was complaining, okay, XYZ is a bad boy, I don't want to be his friends, and lot of conflicting stuff. Now when the mother started using this kind of approach, though yes, it took time, but now at least with the like year coming to an end, or some, we could see a lot of change with that particular child, and mother herself was very happy. Yes, I am able to because when she started using this approach, she herself found certain
Mhm.
changes in her emotions, how you now she's more patient, now she's able to control her anger, and her conflict with the in-laws or with the husband also reduced. So it's like, it's not only you are benefiting to the child, but other ways also, if we follow it, it usually helps a lot. But yes, it's not one time thing, it will require time, and it requires lot of change in your approach, because this is not what we really follow if we specifically see the Indian context. So when parents come to us and they don't have that this kind of approach,
Yeah.
so you have to train
True.
them, okay, yeah, this, if you use this way, maybe you could see changes. So, research again suggests that if when parents are empathetic, they are non-judgmental, and encourage expression of emotions, it not only improve their relationship, it helps the child to focus, his immunity also develop, and future any like he's better able to deal with any emotional conflict that he will have, like he might face in future, so that those impulsive behavior also go down. So in the sense, it's not something which is like in just by one study they have come up with this. They have done a lot of research, and then they came up with it, and they could see changes in child's response and child's overall behavior. So this is what they were suggesting, that if we use this kind of parenting style, it would definitely benefit the child in the like improving his overall personality. So this is what, in summary, I could say, that these are the different parenting style description, and how it is impacting the child or adolescent outcomes. So, Ruchika, if you have any questions at this moment, or anything you would like me to answer at this moment, you are, please let me
Yeah. So I have so many questions, right? So see, mostly like you said, when we see Indian parents, like my parents' generation kinds. So this is first of all the mental health, awareness is
know.
not
Yes,
that
yes.
common, and nowadays even I feel parents are more aware about their child's mental health as compared to the generation when we were in.
Mm-hmm.
So one thing I feel very common in parents is they will say ki, okay, they just don't want to accept the fact ki, okay, aap is pe baat mat karo. If suppose there is a concern in the, like if I, for example, 26 years old girl is attracted towards a boy, and it's not a she's not a that developmentally, it's, there are delays, some kind of delays, okay. So we have to train her emotionally, we have to regulate her, but the priority of the parents is like, don't talk about it.
Hmm.
Okay, so this is where I feel that psychology, mental health awareness issues, they are they become crucial, first of all, for parents, that they should start accepting the fact that yes, my child needs something, and that's I don't know what and how we should approach in this manner, so that it will ultimately give their child a lot of uh, you know what should I say, more acceptance towards them. That is how they'll be more open.
Exactly.
Suppose if a girl, or if any if a small boy, for example, if they go and they deal and they convey their parents that this is what I'm feeling, this is what is happening,
Mm-hmm.
and they are not being acknowledged emotionally at all. So the child will not go to their parents first of all, and future, like we have discussed, like personality issues, and some kids, they are nowadays they are committing suicide so easily because it's a kind of a trend they highlighted in social media
Mm-hmm.
a lot. They highlight for a good purpose, but ultimately kids are
Taking as a
taking it
reference,
otherwise.
yeah. Yeah, he can do, I
Yeah,
can do,
and
yeah. Mm-hmm.
yeah, and this is what I feel, that this is something we need to, being a mental health practitioners, we really need to get into this awareness kind, and especially when we deal with kids, and definitely we are connected to parents also.
Exactly.
So I feel that this is a very important thing. So when you deal with parents, how do you, convey, how do you, like you gave me a very good example, and I'm sure this will help a lot of parents who are watching us. So what do you think, what should be the first key?
First, that's what we will address it in much more detail in our coming slides, which is about what are the steps, which is again given by Gottman and his colleagues only, that how we can develop this. But again, first most thing is, if we as a professional start acknowledging the parents' pain, because like I said in before, and we were discussing that. It's not parents fault, or they are not doing it deliberately or providing certain harm. They don't have that. Their intent is pure. Maybe the communication, the way they are communicating, or the concern they have might be not conflicting. So, and they are
Yeah,
not able to understand that, but pure intent is to help the child. So when going by the same junior kg kid child, the mother, when she's, what was happening with her, with the family is, whenever they're coming to the school, they were hearing complaints, and the same time, when they go home, those complaints, what was, obviously the parent will feel, oh, my child, because child is the part of the parent, so they
yeah,
automatically feel that, okay, these complaints are for me, it is something which is pointing
like
towards
how
my
they
parent.
are raising, yeah, they
Yeah,
take it like that.
exactly. They take it as a question mark on their parenting. So, so when she started, like when the case was given to us, or to our team, so we first started working, like acknowledging their emotions. That, okay, we understand you are in pain. We understand you want better, or like you want something good with this child. Your intent is pure. Only the way is, if you work together, maybe we could bring some change. So when we start acknowledging parents' emotions,
Yeah,
automatically they started acknowledging what we were trying to suggest to them.
yeah,
So that was something we as mental health practitioners, or workers which who are working with the kids and the family. Like the example you gave, a girl's example, who has delay, but she had certain attraction towards the to a boy, or someone like that. So maybe if we first try acknowledging parents' emotion, okay, like, we must understand, yes, already. They must be having certain concern that she already has certain delay now, she's engaging into such acts. What about her safety? And we know how parents are looking at the current scenario in India
yeah,
about girls safety. So if we start acknowledging and making them realize that, okay, your concern is right, but the way we are acting out, or way we are communicating, is it helpful or not? If we give them such reflective questions, I think slowly they will. It's a long process. It's not like
yeah, it is. And
yeah.
surprisingly, everybody wants, I'm not, it's not a complaint, but everybody wants to achieve, this emotion, like a big, like perspective taking, a lot of sub goals in it, right?
Yes,
So
exactly,
this
exactly.
cannot be achieved so early, like within three
Yes.
months you will not get the
No, no, no.
so we need to work with kids. See, in a flow time, like my forte is flow time, so being a flow
Yes.
time practitioner, we work on relationship oriented approach only. Okay,
Mm-hmm.
and I'm so happy that parents, they are getting aware that yes, they need to work with the child. It's not just that the child will do on its own. So
Exactly.
parents are coming up and they are understanding. They are also getting trained in a manner, and the entire this initiative was only and only so that parents should know this thing. Yeah,
Exactly. Yeah.
there are different parts, even the parts which are not visible in, again, in our culture. Majorly parents want that my child should perform academically well,
Yeah.
and emotionally, so we'll see, you know,
Yes.
हो
True.
जाएगा,
True.
ठीक अपने
हाँ
आप
वो
ठीक
हो
हो जाएगा.
जाएगा हाँ.
So this is one thing that I internally thinks they, if जब तक चीजें अंदर से ठीक नहीं होंगी, they will not be able to make it fine, you know, otherwise also
Yeah.
academic and concentration and attention, and I understand these things are very important, but these are all very linked.
Yes.
Yeah, so
Yes.
so
Yes.
like I feel when I don't feel good emotionally, I don't like doing any work. You
Hmm.
know, so you never know, because I, you know, when we deal with autism, where they are unable to communicate much, they
Exactly.
don't have language to
Hmm.
explain basic needs. So how they will explain this? They will not able to first acknowledge their emotions, then
Exactly.
to convey that emotion is a very big challenge for them.
True. True.
And you
True.
know, when you being a therapist acknowledge their emotions, they look at you with such a they give you a gaze like you are getting it.
Yes, true, 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 true. So, in the morning only, I was talking to one of my colleague about one of the child. So, the he had a lot of emotional issues going like within the family also, and he's a very sensitive kind of child. So, when we were working with the child, with the mother and the family, so some issues were happening with him at the class front in the sense that nobody was being his friend and frequent peer fight and all those stuff,
Mhm.
and he was also reflecting it at home as well. So now the other day he was, well, as we slowly worked with him, and other day he was telling his mom that I am feeling very upset, and this whatever I am feeling, I have told to my I have told to Kriti ma'am, please go and talk to her. She will tell
Wow.
you. I don't want to tell you again, but I have discussed everything with her. So yeah, so this tells okay how important is that, okay, somebody is there to me, for me to acknowledge my emotion. With the
Yeah.
same girl I was telling you the case I was discussing, for her also she will call me my counselor friend, because in the school she finds me okay, somebody who can listen me without any judgment. Definitely there are certain skills that she also needs to build on, but I am not judging her for that, for her shortcomings.
Yeah.
So that
So
is what.
yeah, but like I just wanted to conclude that acceptance is the first key, and then we can't just keep our face away from the real emotional issues. Until and unless
True.
we'll resolve these things, our kids and their personality will not be very, very strong.
True, true, true. This what you said, just that acceptance. I think wow, this is what we are focusing on the when we talk about the steps for emotional
Yeah,
coaching. So, like you have to be aware of your child's emotion. If you're not aware, then that connection won't form.
yeah,
And research also says that before being aware of your child's emotion, you should be aware of your own emotions. What are your triggers? Like as parent, it's we understand many parents are working or mothers are working at home, so it's not like it's a like a full working day job. They have schedules, they have meetings, they might have certain conflict at home, some pressures, lot of things are there. And nowadays if you see pandemic situation, everyone is sitting at home, so
yeah,
already parents are bugged up, their schedule is caught up, and at the same time they have kids at home. Earlier kids were going to school, now that space is also not there for the parents. So if the parents are able to recognize that okay, I am this is overwhelming situation for me, if I am able to identify my own triggers, then
mhm,
it will be easy to be deal with the kids. Because most often what happens, we also call it as displaced aggression, where
yeah,
parents start displacing their own tension and stress on the kids, so it spoils the relationship there only. So now, and it is automatically telling your child also, if I am feeling overwhelmed, if I am feeling stress, I can lash out my anger to anyone. So, the same way, indirectly, you are giving a child a message, this is the way you need to cope up. So, if parents are first themselves aware about their own emotions,
yeah,
then only they will be able to aware about my child's emotion. So we often suggest parents to form like a daily log of how are they feeling, like let's say weekly log, Monday, Tuesday, Wednesday, Thursday till Sunday, and try to note down the instances. How was my mood state? Were there any triggers? What are those triggers? So this way, because they also, it's a new thing. Nobody does that in daily life, but
Yeah,
being my aware of their own emotions is very important.
yeah. Keeping the track is important.
Yeah, keeping the track is important. So you're identifying, okay, I am, it's overwhelming, so I need a break. Better you don't start punishing the child at that moment. Maybe asking the child, okay, I'll talk to you, just give me 5 more minutes or 10 minutes, so that I can just I can go out and have a break and feel relaxed and then come back. So it would be a much more better way of dealing with, instead of lashing out your own displayed anger or lashing out your own stress on the child. So first thing is, be aware of your own emotions and your child's emotion. So there are different ways, like you can do so. Like earlier I was giving a example that for you, maybe a broken toy of a, or a if the color of the cup is not according to the child's wish, is maybe a trivial thing, but for a child it's a huge thing.
Yeah,
So maybe for you the stress would be, okay, you have a deadline, you didn't complete the deadline, or your boss is angry, or your house help is not coming up, you have a party to organize. But for a child, that was his stressors, or his events which can cause, or triggers those hurtful emotions. So first recognize those. And it is often said, like if you see this picture where it is like, if you see when the child is is being mad or upset, there can be n number of causes for this. So that
yeah,
anger may be because of certain fear, anxiety, embarrassment. So as a parent, you have to look into, dig deep. If he or she is being mad, what can be the reason for that? And that can be easily done if the kids are small. Like we usually use in our counseling sessions, we'll ask the kid to draw or play with their like toys and stuff. So when they engage into make believe play or pretend play, look at the way they are responding, or
yeah.
how those characters are interacting.
Yeah, it's very
So
important to watch their
yes,
play, I feel. Yeah.
yes,
And
yes.
whatever they are drawing, this is a very good way. Yeah, I can suggest this to all the parents that they should always watch what their kids are drawing, because half
Exactly.
of the things they are just projecting there.
True, 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 true. You are
Even
right.
kids who are not able to communicate well, they can always draw. And this is a very deep analysis, even I am doing from the past 11 years.
Yes, true.
I
Yeah, yeah,
always
you
look
are.
into their pictures.
Yes, pictures, and this, if you're narrating a story also,
Yeah, how they are
how they are,
creating it.
yes, how they are creating it.
And they will
So
always highlight the emotion they feel.
yes, yes, it is like, it's the best, I think, projective technique, if we call it in a
Yeah.
technical term. But yes, it will automatically happen. So the other day, like in the beginning of, there was a girl who shifted from US to this particular school. So there, what happened when she was shifting? So the mother and the brother and this daughter came. The father was there, and they had some business loss. The father had to work for some more time, but in the meanwhile he sent both all three of them to India. Now girl was very much attached to father, and she the boy, what happened, he was born and brought up in India, raised there. But with that girl, she was born and brought up there, the kind of environment, the kind of people she had, and more important, the father, she had a close bond with the father. Now what happened, when we were discussing the same with the mother said, like, because she was, when she moved to the school, we were finding there were difficulties in for her to interact with kids and form a relationship. She would often feel, oh, like she would give different bodily reaction. Oh, I don't like this, I don't like that, with proper accent and American accent like that. So the teacher was in, like, she wanted to support her, and the parent came, basically first mother came. So she said, no, there's nothing like she's missing father. She was a person who who didn't cry when they were leaving from that particular place. So now, overtly, the mother was only seeing that, okay, she didn't cry, which means she didn't feel the pain. But
Yeah.
inside, when we were working, when we were asked her to work with the story, from the story I could sense a pain, that she is missing her father, she's missing her whatever environment she was there, and that emotions were not being addressed.
Mm-hmm.
So first thing is, we these are very minor things and we often
Yeah.
overlook them. So if we are able to create, or if we're able to figure out or pinpoint these moments, we will automatically being aware about their emotions. So sometimes, like, we already know that when they are and have some troublesome emotions, their sleep might get like disturbed, appetite. You can see their performance at school level, frequent absenteeism or illness. All these are telling you certain, giving you cues that something is happening with the kid, and we need to
Yeah.
address that. So first step, if we are able to clear that, then the second steps come is recognizing that opportunity for the connection. So now when we see dismissing and disapproving parent, they, when they encounter negative emotion, they shove it off, and they don't see it as an opportunity. Let's connect with my child, let's probe it further, let's have a bond with the child. But when we see emotion coaching parents, they look at this, they use it as an opportunity to connect with the child by having a eye contact. Like we usually say, na, you have to go down to the child's level. So
Mm-hmm.
you, the parents start acknowledging, okay, there is something which is going on. Like for the example here, it is given that don't take your child's emotion personally. So this isn't about you, even if she's screaming I hate you, this is about her tangled up feelings. Or maybe because, see, thus kids are very small, they
Yeah.
won't tell you that, oh, mama, I have moved to a new school, so this transition is difficult for me. These kids won't tell you, especially
Even
this.
they are wondering now what is going on with.
Yeah, what is happening with them. And same goes with adolescent, because adolescent already they have a lot of confusion and all those hormonal
Yeah.
changes, their mind is completely messed up, so it is
Yeah.
difficult for them to at least communicate. So we have
Yeah.
to recognize, and we have to work out with them, form a connection. And then if we are able to form a connection, then the third steps come is the labeling the emotion. So again, an important step, why we are saying labeling the emotion, because like I said earlier, anger can be of different names. Anger can be of feeling of upset, anger can be feeling of resentful, anger can be feeling of envy. Similarly, if you are being sad, sad can be I am feeling empty, I said can be I am feeling lonely, sad can be I am feeling upset. So there can be different emotions for
Feelings.
it.
Yeah.
Yeah. So if we see this particular picture, I think I can do the slideshow for this one. Yeah, this one, this particular picture. Here, if we see, if the parents can take a note of this, that sadness might be telling you this, loneliness might be telling you this. So if you take a look at this and try to figure out, okay, if I have a feeling of resentment, that it must be telling me that I need to forgive. If I am feeling angry, I must check my own boundaries. If I am feeling anxiety, there's a chance that I have to step back and breathe. So these kind of labels the parent need to provide it to the child.
Yeah.
So, like in the example above, when you are seeing the Rohan's example, mother was acknowledging his emotion by saying, "Oh, you are feeling sad, you are feeling hurt. Those words are harsh." So it is the child is getting that vocabulary that, okay, yes, I am feeling hurt, or I am, those words were rough. So all these things are giving a child an understanding that this is what I am feeling. And when we provide them these labels, they automatically feel calmed down. So one of the worksheet we can like this you can create and do it with the child, like this is you can parent can sit with the child and ask him to fill it up. Okay, this is how my body feeling currently, ready to run, light and airy, no I am my clenched teeth or jaw. So these are different situations. If a parent can sit
Yeah.
and make the child identify what are the emotions, then it could be a good activity for a parent to sit. It not only provides a connection, like you said, that playtime is very important for a parent child bonding. So
Yeah.
this way they can form that bond and have like child will also feel like somebody is there who is acknowledging my emotions.
Yeah.
So I think with one of our kid, we were using emotions bingo, or we show them emojis, because emojis are nowadays very commonly used, and
Yeah.
children identify those very quickly. So maybe if like sometimes what we do is we gave a show a particular emoji and ask the child, okay, when did you feel like that? Can you tell me a story? Can you create a story around it? So this is how we
Mm-hmm.
are giving the child vocabulary, and we are able to label the child's emotion. So
Yeah.
this is important as a step number 3. Now, which is important core element of emotion coaching is empathy. So if you can see this slide, they have given there are certain disconnecting words, or there are certain connecting words. So if I say stop crying, tell me what you need. So this is the way if I am communicating. Instead, if I say, okay, you would like to listen to me, you sound very frustrated, I can see you are crying. So now you can see the difference in terms of my tone also. If
Yeah.
I stop crying, tell me what you need, is like, okay, there's a demand on me, and the child feels, okay, nobody is welcoming my emotion of crying. But here when we see a connecting word like you would like me to listen, and you sound very frustrated, here the child feels, oh, somebody is acknowledging my emotions. So if we are able to figure out what could be the disconnecting words, or what could be the connecting words, or just by changing my own tone or the
Yeah.
way I am communicating, automatically the child feel, oh, my mom and dad are there for me. My mom and dad understand me. Because at the school front, or maybe with the friends, they are also same age peer group. They those peer group can't show same kind of empathy. So at least there's some adult with the child who that adult who can understand the child's emotion.
Yeah.
This
So
is
one
yeah.
more thing I want to like balancing emotion, like knowing your child's emotion, and then balancing out is also very important. So at times, some parents, they love their child, of course. So they'll do whatever the child would want to do, them to do, basically. So if he needs a particular glass, they will give him that particular glass. You know what I mean?
Yes,
And
I understand.
and the child will not understand that, okay, I can take no also, well, because they have not even got this exposure of no.
Yes,
So
yes.
understanding your child need and then balancing out is also very very important, right?
True,
And that
true.
also we can try it in connecting words.
Yes, yes, yes. So even if if I'm like when we move to step 5, where we try to set limits and problem solving, there we would be able to see, okay, the how we have to set the limit.
Yeah.
Let's say a child is getting mad, and or somebody, like let's say Rohan like broke the Rahul's toy. Now, because of that, Rohan hit who Rohan has hit Rahul. So now, when this child, this situation is there in the front of the mother or father, so they might say that, okay, I know you are hurt because Rahul broke your toy, but the way you reacted to him is not correct. So at the same, you are acknowledging that I know you are feeling bad. Even if I am would be in your position, I would also feel same, but the way I acted out is not correct. So somewhere we
Yeah.
have to set that limit.
Yeah.
Then
Right.
only, because if nowadays, if you see, like you said, that parents are not able to make a balance between what to, like, they are giving everything to the kid on a platter. So now if you
At
see the
times.
when you see the kids attitude, or they are not bothered about the boundaries, or they are not bothered about, okay, if I am getting, my parent got me a thing, a, what would be the, what is the like hardship behind this product, like what, how much my parents have given hardship or done hard work to gain this particular product. They are not able to understand that, because parents are fulfilling each and every demand. So again, like you
Yeah.
said, balance is very much important. So yes, we have to communicate to the child that you are not alone in this. We are there with the child, and if we are able to do so, then the child feel okay. My unpleasant feelings are hurt. Somebody is there for me. But if you are not able to do so, then your children will feel nobody is there, and it start impacting their like they develop unhealthy coping strategies. When they go old, so all these risk taking behavior, drugs abuse and all those stuff, they might get into that, because they don't know how to cope up with the emotions.
Yeah. And their own parenting style and their own relationship there, it affects a lot.
Exactly,
Yeah.
exactly, exactly. So, like you said, step number 5, limit setting and problem solving. So, if you see this picture, they have like speak wisely, enforceable limits for kids. So, say, I will listen to you as soon as your voice is calm and quiet as mine. So, you are saying in a calm tone instead of don't talk to me like that. You better be
Yeah.
respectful. So
Yeah.
can we at the same time show, because when I am using this statement, don't talk to me, I am also being harsh. I am also showing my anger and frustration. But when we say I will listen to you as soon as your voice is calm and quiet as mine. So you are being assertive that I will only listen to you when you being calm. So you have to
Hmm.
first calm down, then only I'll come to you. So
Yeah.
similarly, I'll serve you lunch when you are sitting quietly in your chair. Instead, stop whining. You better be quiet if you want lunch. So these are certain examples parent can look and try to try to first reflect back how this thing is, like how we are using these terminology in our day-to-day life, and how I can modify it.
Yeah.
So if we are able to set certain limits, then like in this example, like I know you get frustrated when we are going to market for, and you don't like to spend some time. If you are feeling like that, do let me, we'll take a break.
Hmm.
Or maybe if you're feeling like that, you can come out of these anxiety provoking or conflicting emotions by maybe by taking a break, playing with your pet, drawing something. So if we do that, child also come up with a creative solution. So that is what important is, that you first identify the problem with the child. Then second is, okay, if I am identifying the problem, tell me, share, I am there to listen to you. Then check, okay, whether I am feeling right or whether I am evaluating the situation right. If then when if we do the second step, then tell the child, now it is time to take the responsibility. If I have, okay, I was feeling hurt, I, because Rahul broke my toy and I hit him back. Now, okay, I have shared my feelings. Now I have to take responsibility to change my behavior, because hitting is not allowed.
Yeah.
If I am hurt with Rahul, I have to communicate properly, not by hitting, not by scolding or yelling at him, because that's a unhealthy way to cope up. So can
Yeah.
I brainstorm certain solution with my child, like we discussed earlier in the beginning of our presentation, where you might not be able to give a best solution to the child, but at least with collaborative work we can brainstorm certain solution, we can choose. And then also it is important to teach the child, because if you see nowadays, children are forgetting the essence or the importance of why we need to forgive, why we need to feel gratitude. So that feeling is also, we need to nurture that in order to make them a better citizen in future. So if
Yeah.
we could nurture these feelings, automatically the child will, after some time, he will able to soothe himself automatically, and he will automatically come up with certain solution.
Yeah. So one
And
more thing I want to
yeah.
add here,
Hmm.
like like if a child got a problem, okay, and parent is definitely brainstorming some solutions, and the child is also doing the same, but depending on the intensity, if the intensity, like suppose I'll say it's, if there are anger management issues,
Hmm.
or for example there are other issues which parents are not able to identify, so then definitely they should be open for for help, like going to the psychologist and trying out the ways.
Yes, yes, that is more important, because if even if we see in our practice as well, we'll first work out with the parent, giving them strategy. If they are not able to do so, then we will start taking care, like calling the child to ourselves, trying to judge, okay, whether, because like we all know, there are developmental disabilities as well. There are certain delays and disabilities where these issues crop up. It is not a normal everyday behavioral or emotional issue. It is much deeper level. It is happening because of a particular disability or a lack of particular skill. So then as a therapist, like you said, then our role as a mental health practitioners, or a rehabilitation professional or a counselor comes into a play, that yes, we have to work with the child. So parents again have to be very mindful that okay, this is now going beyond my like control. I have worked with the child. I have given him, like if you see in this picture, they are given like a, it's like an example for the parents. They can give like A to Z coping skill, what they can do. Even of that also, it is not helping the child, then there must be something serious. And if we would get an external help, then it is much more better, it for the
Yeah.
child and for the family itself.
Mhm.
So yeah, these skills can be taught in terms of a playway method also. Like I think you would be better able to give an example where through drawings and through playway, or even when we do a pretend play kind of
Yeah.
like setup with the child, how we can give a coping skills, how we can tell them okay, you can do like that. And these
Yeah.
things are unconsciously being, sorry, nurtured in the child.
Yeah.
So yeah.
So Kriti, not only kids who are developmentally delayed, or but I have seen kids who are perfectly fine developmentally, but they have some basically anxiety issues, or they some kids, they just cannot, they cannot just communicate with their parents exactly with
Yes,
what they are going through.
exactly.
So a girl who is like 8 years around, so she was scared after what she was scared of this concept of ghosts. And
Okay.
and at this particular age, kids, they don't understand that there is a difference in a fact and a reality.
True.
If I talk about 6, 7, 8, they feel fascinated about something which is not there around. And some kids, they feel so excited to talk about, peer group, basically. In peer group, they have something to share about these things. And some kids, they find it real, and they make it real. So the girl never used to go to the washroom in school. She used to feel that there is a ghost.
Okay.
And at times she had you know accidents also, so
Mm-hmm.
accidents in the classroom. And for
Mm-hmm.
a big girl, this was like, again, it was become a vicious circle, because she cannot go,
Exactly.
because she was scared. And then she was doing something which was like creating guilt in her and shame in her. So this was the root cause of other behaviors.
True.
And she was completely quiet. She used to get more in the shell after all this. So
True.
replacing these things, because what a normal parent will do, a normal parent, definitely they'll say, what are you doing, and there is no this, that, so maybe they need, at that particular time, that the girl required external help, so that
Exactly.
cognitively, that emotion and that thing will be replaced by something better.
True.
And that I think at some points we need to understand that simply no will not help our kids. They actually need a different way to get into that. And yes, like you said, ki pretend play has helped that child a lot. So
Hmm.
getting into the tent house, taking the toys, making a story, giving that alternative in that story.
Hmm.
You know,
Hmm.
parents,
Hmm.
other parents can really try giving alternative uh, within this pretend play gives kids a lot of other uh, ways that how they can deal, so that they feel
Exactly.
okay, this is going
Exactly.
on, so I can also try the same in real life.
Yes, true, true, true. These things are like when things are out of control, now it is not in my hand, then parents shouldn't shy away from taking help because it is not serving any good in terms of to your child or to the parent or their relationship or in the house only. So
Yeah.
better sooner if they realize, okay, it is something which I need certain help, then it is better.
Yeah, and I think every child they need some kind of an emotion guidance when they are at a growing stage, or at particular stage, every child they feel that they need something.
Yes,
You know, that
yes.
emotional containment.
Yes, yes, yes. So this brings to my last slide where I just want to give the message to the parents that it's not like we are talking about their feelings or kids' feelings, so we are not bothered about their feelings, as we are acknowledging the fact that their parents' feelings do matter. So it's parenting is a roller coaster ride, and there's no a bible or a manual
Yeah,
which can be given to the parent. Okay, give you, you take, and then you start following, because you have to adjust your expectation according to the developmental stage or specific ability, limitation, strength of the child. If you are over expecting and you're expecting from a 6-year old to empathize with you or to understand your perspective, how can
yeah,
that be possible?
true.
Because it's all, they are already in a growing stage, they are in the developmental stage. As an adult, you, it's your responsibility to develop their emotional like value or give, make them understand things. So adjusting your expectation, and most importantly, which we tell the parent, because like I was telling you about that junior kg kid, child. So there we told mother that you need certain break, because
Mm-hmm.
she also was getting overwhelmed by everything. And so we told that okay, if things are going out, you take a break, talk to your friends, do some meditation, get into some hobby thing or
Mm-hmm.
gardening, anything which helps you calm down. So you also need to take a break. And like I said before, you have, as a parent, you have to identify the trigger. And if you are able to identify the trigger, then try to work on those triggers. Okay, if I am okay, and this is that I am getting angry, I need to just move out of the situation. I will talk to my child later on, I'll discuss things later on, but this is too much, I need to just move out of it. And finally, if you, it's nothing wrong if you apologize to your child, because it is indirectly telling your child that if I have done a mistake, it is important to take responsibility and say sorry for that. So,
Yeah,
and give reasons why I felt. Often parents don't give reason why I am feeling like that, they will just give the command. So
yeah,
now kids also need the reasoning why you did like that, why you reacted like that. What if you share that, because it's a two-way process, they will all,
yeah,
it's a collaborative effort. And more if you do as a child grow up, because in an adolescent we all must like aware that how things are. And automatically, because of developmental changes or hormonal changes, there's a drift between, or gap between parent and the child. But that that gap, as a parent, we need to build it.
yeah,
So if that emotional communication or like at least exchange of ideas or feelings are there, then automatically you, there would be a good like positive bond between the parents. This is what I just wanted to explain it to parents, so that they will be much more aware and start at least realizing and start practicing in their daily life. Yeah.
yeah. I hope it will help a lot of parents, to
Yeah.
to
Yeah.
understand, and first of all, they will notice their own emotional needs, and how they can
Exactly.
work on it.
Yes, true, true, true. So this is the end from my side. I just wanted to thank you so much for like this in giving me this opportunity to interact with. I'm sure you. I know you are doing a great job. You have a own
Thank
setup.
you,
You are
Kriti.
you are like you are using play therapy, and it's important that we connect with our fellow colleagues in this field, so that it's important. And it is all like sometimes I might not be able to come up with the idea, but just after the discussion I may able to apply that same idea, because
Yeah,
you are working with the child, and we, because of this exchange or dialogue, it's like beneficial for everyone.
yeah.
So thank you so much for that, and
Thank
I
you, Kriti,
hope
for giving us time.
yeah,
And
we will have more session like this in future.
yeah,
Yeah,
let's see. Yeah, I am hoping for more sessions. Yes, and I hope this will help a lot of parents. And
true.
if any parents feel that they want to ask something related to this topic, they can always ask questions in the comments, right?
Yeah, yeah,
And we'll
yeah.
be happy to answer.
Yes, true, true,
Yeah.
true. Yes.
Okay, Kriti, thank you so much for giving time. See
Thank you
you.
so much. Bye bye. Take care.
Bye bye. See you.
Bye.
Bye.